Hello everyone and welcome to our 93rd AeHIN hour. If you need assistance, please use the chat window, and if you're having difficulties in configuring your connection, please log out from the session and rejoin again. You may also use your smartphones or tablets to join by using the webinar ID 341-611-867. Please be reminded that all microphones are muted throughout the meeting. For comments and questions, please use the questions box and the comments box. The Q&A will be done after the lecture. For tonight, we have 4 speakers. Our first speaker is Dr. Heidi Reynolds, Director for Evaluation for the Measure Evaluation Project. As Director for Evaluation, she leads the Evaluation Unit and all health areas technical groups. She also leads the project's learning agenda with the mandate to measure countries' progress toward robust health information system and to build the evidence base of what works to strengthen HIS. Next is Ms. Shannon Salentine, Measure Evaluation's Team Leader for ICF. She has 15 years of experience working with national M&E, HIS, and implementing partners to improve the availability and use of health data for decision-making through capacity building and system strengthening. We also have Ms. Ashley Strally, Monitoring and Evaluation Manager with Measure Evaluation. She monitors achievements of the project's health information system, strengthening portfolio, and also has experience conducting health systems evaluations. And of course, we also have Dr. Tariq Azim, Senior Technical Advisor for Measure Evaluation, with experience and expertise in assisting countries in assessing, redesigning, and strengthening their routine health information systems and health systems. May we now call on Dr. Tariq.
Hello, everyone. Welcome to this webinar. It's my pleasure to introduce you to Measure Evaluation first. Measure Evaluation is a project funded by United States Agency for International Development, that's USAID. And as Measure Evaluation, we have a mandate to strengthen health information systems in countries with low resource settings. And we strive to enable countries to improve lives by strengthening their capacity to generate and use high-quality health information to make evidence-informed strategic decisions at every level, like the local, sub-regional, and national levels. As such, Measure Evaluation is also collaborating with AeHIN in setting up a RHIS, or Routine Health Information System, focus group within AeHIN that will support the AeHIN member countries in building their RHIS capacity and regional collaboration among the AeHIN countries for strengthening the RHIS, or Routine Health Information System. So this webinar, in fact, highlights the global resources and tools that's available through Measure Evaluation and how to access them using the Resource Center of Measure Evaluation for improving the RHIS in a country. So having said that, I will invite Heidi Reynolds to start with her presentation. Thank you. Up to you, Heidi.
Thank you, Tariq. Hello, everyone. Hello, AeHIN community. Thank you for letting us join you today to share a little bit of information about the Health Information Systems Strengthening Resource Center. I am here in Chapel Hill, North Carolina with my colleague Ashley and Shannon Salentine. We will be talking a bit about the components of the Health Information Systems Strengthening Resource Center. Normally, we have our small team that we work with, and the rest of them are off traveling the world learning. So they are not here today, but I would like to acknowledge them: Liz Millar, Ava Silvestra, and Emily Bobrow. As well, I would like to acknowledge that we work with a technical advisory group that is made up of representatives from our partners on Measure Evaluation and guide us in the technical direction of the work that we undertake, and the results of which you'll see here today. I would also like to acknowledge the United States Agency for International Development, USAID. As you heard, we are a USAID-funded project, and it is because of USAID's request to understand better the effects of investments in health information system strengthening that we are presenting here today to you about this resource center and the activities that we are undertaking in order to centralize the evidence about what works to strengthen health information systems. Let me start with a bit of the purpose for the webinar. We're going to provide an overview of the Health Information System Strengthening Resource Center and describe some of the content. In the first part, we're going to talk about the Health Information System Strengthening Model. That is a foundation of all our work. Shannon will be the one to present that. It really helps guide and communicate the work that we are doing in Health Information System Strengthening. Then Shannon will also discuss the health information system country profiles that we have. This is a site where we have the status of 39 countries' health information system on the Resource Center. Then we will switch to Ashley, and Ashley is going to present some about the Health Information System Assessment Tool Database. This will help you find all the tools that you need to conduct your assessments of health information systems. And then Ashley will also be talking about some of the other resources you can find on the Resource Center. I want to make clear that the Resource Center is a work in progress. It is a place where we are centralizing all of the resources and findings that we are gathering during our work on health information system strengthening, but we really rely and value your feedback and input. So there should be plenty of time, and we will show you some ways at the end that you can provide some feedback. Before we dive in, however, I want to put this in the Health Information System Strengthening Resource Center in a bit of context for you. Probably for an AeHIN audience, you all are well aware that a health information system makes up part of the one of the 6 functional areas of the health information system. And as such, the health information system contributes to the outcomes of universal health coverage, including financial protection, essential services, population coverage of health services, and a responsive health system. And ultimately, a health information system contributes to improving health outcomes. However, a health information system has not been typically a topic of systematic study and inquiry, and Measure Evaluation is working to change that. We have a learning agenda, and in that learning agenda we have a portfolio of activities that are working to answer 3 key questions. They are: what are the factors and conditions of health information system performance progress? What are the stages of progression to a strong health information system and how are they measured? And what are the characteristics of a strong health information system? And we are working to identify evidence-based packages of health information system strengthening interventions and building the evidence base of what works to strengthen the health information system. This is all in an effort to answer questions posed to us by USAID of what are investments in health information system strengthening giving us. And all of that is archived, is being centralized in our Health Information System Strengthening Resource Center. This is a work in progress, but we are delighted today to be able to show you what there is, and hopefully you will stay tuned to keep seeing what is added to it, as well as provide your information about what should be there and what you would like to see. This is just a screenshot of the Resource Center. After Shannon presents on the Health Information System Strengthening Model, which is next, we will turn to the website to show you how to get to some of these resources on the site here, and then we will switch back to some slides. I think we're going to go ahead and do that all from the location where I am, and so to the extent to which we can manage that, we will do that. So I'm going to turn now to Shannon. Shannon, why don't you go ahead and tell us a little bit more about the Health Information System Strengthening Model.
Great, thanks so much, Heidi. So I'm very excited to tell you all about the Health Information System Strengthening Model. This is a model that was developed by the project team to promote health information systems as an essential function of the health system, define HIS strengthening, monitor HIS performance, and monitor and evaluate HIS interventions. It articulates the project's current understanding of the health information system. It guides our ongoing learning of how HIS in low and middle income countries can be developed and implemented to support health systems and improve health outcomes. There's a serious focus on HIS strengthening at the country level, and the model can also guide countries in the assessment, planning, and improvement of their HIS. Next slide. So this is what we're calling the Health Information System Strengthening Model, or the HISS model. Using the Health Metrics Network framework as a foundation, we worked with project experts and our teams working in the field to develop a model that could be used to do two things. The first is to help us tell the story of what is being or has been done in strengthening health information systems. And the second is to help us further write the story, meaning guide countries and technical advisors in assessing, planning, implementing, maintaining, and sustaining a health information system. We have developed the model in a way that reflects back the message that health information systems are intended to meet the information needs of the health sector. And we also wanted to emphasize that the health information system is just that, a system. And as a system, it is dynamic, there are relationships between each of the components, and the system is influenced by external factors. So as you can see in this representation, there are knowns and unknowns. The unknowns being those things that we need to study and understand more clearly. As a project, we've been using this to talk through health information systems and our understanding of how they function and perform. It's been used by our field teams to map the strengthening activities that are being undertaken and identify opportunities for additional support. Next slide. On the far left of the model, you'll see that we've included the enabling environment. There are two major components within this area, HIS governance and leadership and HIS management. And you can see that we've included a number of different illustrative types of activities that fall within these gears, including legislation, partnership and coalition building, policies and standards, system champions, financing, human resources, capacity building and training, information management, and infrastructure development. Moving on to the next set of gears, we have the area of information generation, which is the operationalization of the HIS through data collection, cleaning, processing, management, analysis, packaging, and dissemination. And I want to point out here that the data sources being referenced are all those required to fulfill the health sector's information needs. These are both population-based and institution-based, routine and non-routine, and include household surveys, census, vital statistics, patient records, facility and community-based service statistics and disease surveillance, resource data for finances, human resources, infrastructure, pharmaceutical supply chain, and lab. Moving on, we have the gear of HIS performance. And within this gear, what we're doing is really looking at how we measure the performance and the actual strengthening of the health information system. So this is the major outcome of strengthening the health information system, and we have two areas that we focus on: data quality and the systematic and institutionalized use of data. Moving on, at the far left of the model, we have the two impacts of the HIS, which include improved health system and improved health systems and improved health outcomes. Although we know that this can't be achieved with the HIS alone, this is the aim, or sort of the end game, of strengthening the HIS. And so we want to keep these as part of our model so that we always know what we're heading for. Next slide. As we continue to learn from our work in HIS strengthening, both across the project as well as relevant non-project research and evidence, the model is useful for these key areas, or these key reasons. One is to standardize how we talk about HIS strengthening, including the terms we use and the key principles and messages we've developed. This involves drawing from what we know, anticipating the future, and getting very clear in our HIS strengthening principles and defining elements. The second is conceptualizing the causal frameworks, outcomes, and interventions. This is really the pathway between the need, the response, and the results. What do the countries need? What are the interventions that will be used, applied, or adapted? And what is the effect on the HIS? And then even further than that, what are the effects or the impacts on the health system and health outcomes? And the third is to measure, synthesize, and communicate HIS strengthening outcomes. This entails providing a framework for measuring HIS outcomes, synthesizing learnings across the model, and communicating these outcomes in a compelling manner that maps back to the model and our HIS strengthening anticipated outcomes. Next slide. So there are a few resources available that accompany the HISSM graphic. The first is a brief 3-page summary of the model's purpose and a description of each area in the model that goes into much more detail than what I was able to describe today. This overview document is also available in French. For managers, measure evaluation staff, and other project staff implementing HIS interventions, the second document describes in further detail how the HISSS model frames what we know and what we need to know about HIS strengthening. This is a longer document that goes into more detail and lays out even more of the framework for HIS strengthening in our learning for HIS strengthening. And this longer narrative describes our HIS strengthening processes, discusses the importance of the human element in HIS strengthening, and also highlights some key illustrative interventions being used to strengthen HIS. It's based on appropriate assessment methods and HIS sustainability. It also describes the need to measure HIS performance and monitor and evaluate specific HIS interventions. In addition, there's a PowerPoint slide deck on the HISSM, very similar to what I just presented to you today, that can be used by anyone interested in sharing this model with others or using it as a foundation for their own HIS strengthening work. Okay, so now I'm going to do just an overview of the HIS country profiles. So one of our big tasks under measure evaluation, as requested by USAID, was to develop some country profiles for, as Heidi said, 39 countries. And these are 39 priority countries where USAID works and has significant interests in supporting the strengthening of health information systems. The countries were identified, and the request and the question that we also had was, where are all of these countries in strengthening their HIS? And how can we measure where they are in strengthening their HIS using some standardized indicators across all 39 countries? So as you can imagine, this is a huge task. We did not necessarily have the resources to go and assess all of these 39 countries, and so our approach was to do a desk review and really engage our counterparts in country, whether they be project staff or contacts that we have through our various networks, to collect the indicators. And you can see here on the screen all of those countries on the map. They're all highlighted and hyperlinked, so you can go to each one of the country pages to see what we found across each of the 30 indicators. And if you click on one, Bangladesh, you can see the list of indicators on the left-hand side in this beautiful table. You can also see when the indicator, how the indicator was collected, or what the time frame was for the status of this particular indicator, the source of the indicator, so the data source, and then any kind of notes. So going across, if we were to pick the health sector M&E plan for Bangladesh, you can see that they do indeed have a plan, but the only one we were able to find through our counterparts was the one that's not current. It was the 2011 to 2016. Even so, we have a hyperlink to where that is. And Ashley's going to click on that. And it will take the user straight to the monitoring and evaluation strategy and action plan for Bangladesh. So going back, just want to show you a few other things. If you scroll down to the bottom, what's interesting is that we've chosen these indicators. Some of these indicators are very straightforward. Many of them, as straightforward as they were still pretty difficult to find. And you can not only look by country, but you can also look by type of indicator. So for example, Ashley, if you can take us to where the If you scroll up to the top, you should be able to go to the actual list of indicators, and then you can see which countries have those types of products and those types of strategy documents, and you can get a whole list of them. So not only does this not only does the country profile actually do a good job of telling us where individual countries are, but they also help us look across countries to see what countries are doing in terms of these different types of indicators that we're using to measure what they're doing in terms of strengthening their health information systems. Thanks, Ashley.
Thanks. Okay, so I'm going to talk through a few other resources on the HIS Strengthening Resource Center, starting with the HIS Assessment Tools Searchable Database, which is the green tab. The Tools database is one of the newest features on the Resource Center, and you can access it along with all the other resources on the left-hand side of the page. But clicking here will bring you to on the green panel will bring you to the searchable database. We created this resource because of the growing number of HIS assessment tools that are already available and those that are being developed, each with different purposes and that meet different stakeholder needs. This database houses information on these tools in one place. So if you're looking for an HIS assessment tool, the database can help you find the tool that's best suited to your needs and context. We currently have 32 different tools included in the database, and this includes tools that have been developed by Measure Evaluation, but also tools developed outside of the project. We gathered information about existing tools through web searches and by talking with HIS experts, including some of the developers of the different tools featured here. When we were developing the database, we also spoke with HIS managers in the field about what some of the most useful things would be for them to know when they're selecting an HIS assessment tool to use. And based on their feedback, we came up with a set of criteria for categorizing the tools and that you can search for in the database. So these include the assessment purpose, which level of the health system the tool is intended to address, the specific assessment areas, like HIS governance and leadership, HIS management, and data sources. And these actually parallel the areas in the HIS strengthening model that Shannon shared. We also categorize the tool by the data collection method and other criteria, including context, gender, and how long the tool would take to implement. To use the database, you can do a couple of things. You can use the search tool at the top if you know the name of the tool, exactly what you're looking for. So I'll type in PRISM and press find. And this will take me to a list of tools with my keyword PRISM anywhere in them. The list includes the name of the tool, the author of the tool, and a short description. I can also click on the name of the tool for a link to more information about that, including how this fits into our database criteria and each of the keywords used. There will also be a link to the actual tool itself if it's available online. And you can click through that to actually access that tool. Go back to the database. I can click back to the search form if I want to get back. And the other way that I can search for an HIS assessment tool is by using the different criteria. So I can say, perhaps I'm looking for a tool that is routine monitoring at the facility or community level, and I'm interested in data sources and data use, and so on. And I can scroll down to the bottom and press find. And again, I'll generate a list of tools that meet my specific criteria. Again, I can search back to the search form to go back. And if I want more information about the searchable database and the different keywords that are used, I can click on About this searchable database. And it will take me to a page that describes each of the search terms and criteria that are used in more detail. There's also a place near the top of the page to contact us, and you can let us know if you have any feedback on the search criteria that we used, or if you'd like to let us know about new or additional tools. We do have plans to update this database regularly. Our hope is that it is relevant and useful, so we are looking to add new tools to it. The next feature that I'm going to talk about on the Resource Center is resources. So it's the orange tab here in the middle. And one of the functions of the Resource Center is to be a place for sharing the latest tools and products and resources related to HIS strengthening with the global community. And this includes making sure that the documents and the resources we collected for the country profiles that Shannon talked about, for example, as well as the resources that we use to inform the development of the HIS strengthening model, are all stored in one place and are easily accessible. So on the resources page, we have a list of topics: National Health Strategy, HIS Policy, HIS Strategic Plan. And by clicking on these, I can come up with a full list of all of the source documents used for the country profiles. So instead of looking just in Bangladesh, I can here look at the strategic plans for all of the countries. So these are listed by country, the document is linked to when it's available, and we also include the status, whether it's current or not available. And I can click through on any of these links to go to the source document. Just pulling up here. So here's the HIS strategic plan for Afghanistan, for example. If I go back to the resources main page and I scroll down below the list, there's also a section of resources that were used in the development of our HIS strengthening model, and these are linked to when possible. So you can open up these different resources that we use to inform the model. The next feature I want to point out on the Resource Center is the Health Data Collaborative tab. As it says here, the Health Data Collaborative is a joint effort by international agencies, governments, donors, and academics to improve health data and make progress towards the Sustainable Development Goals. We have a link to the Health Data Collaborative, or HDC, website that you can follow. And on our main resource page, we have some more information about Measure Evaluation's contributions to the Health Data Collaborative. So if you scroll down, there's more information and also a link to resources where we are contributing, such as M&E training resources on our website, and also data quality tools, such as the data quality review and the data quality audit that are contributing to the Health Data Collaborative. The next tab moving down is Regional Networks. And here we include a list and some information about 7 regional networks working in the area of HIS. Of course, we have AeHIN featured on this page, also some other networks. And you can click through any of these links to go to the networks page if you're interested in learning more about what the group is currently working on. So moving along to the next tab, which is HIS definitions. We've noticed in our work that definitions of HIS vary quite a bit by source. So what we've done here is put our own measure evaluation definition of HIS, and we've also linked to how others define HIS. Again, linking to some source documents that might be useful, such as this one from the WHO. We've also provided definitions of HIS subsystems. These are short definitions here, and you can click on each one for more information on routine health information systems, for example, or on logistics management information systems for more information. And we tried here to link not only to measure evaluation resources, but also to resources from other groups working in HIS. The final tab that I want to cover is this one, HISSM in action, near the bottom. And this is actually our newest content on the Resource Center. And this is where we've taken HIS strengthening activities that Measure Evaluation is implementing in different countries, and we mapped them to the HIS strengthening model. So we'll scroll down and open one of these examples to walk through for Côte d'Ivoire. Actually, I have it up here. So we started out by describing some of the basics of the HIS strengthening model, and I won't cover that since Shannon already presented on that, as well as some context about Côte d'Ivoire. But then what we've done is taken the model graphic and superimpose some information about what we're actually doing in that country. So for example, under information generation, we have worked with the Côte d'Ivoire Ministry of Health to implement several interoperable subsystems. And under information products and dissemination, we have helped them to produce their first annual health report. We also describe how the activities contribute to improving data quality and data use. And we include even more information in a table on the next page. And this again is mapped by the HIS strengthening model areas and sub-areas. This application of the model to country level work is helping us answer our overarching question about what works to strengthen health information systems. And it also provides other examples for other countries that want to think about their HIS strengthening activities through the lens of the HISM. So I'll go back to the main Resource Center page. And oops. Also on the HISSM in Action page, there is a link to more information about the model sub-areas, including illustrative examples of activities that might fall into these areas. As I said before, this HIS Strengthening Model in Action content area is the newest feature on our website, and we're currently in the process of adding additional country examples and expanding the content. That concludes the overview of the Resource Center content. So I encourage you to explore the website on your own and click through the various tabs. And please also feel free to give us your feedback on what you like or what you'd like to see more of using the Contact Us button at the bottom. Now I'll pass it back to Heidi.
Hello again, everybody. Thanks, Ashley. Thanks, Shannon. I just have a couple of final slides before we open it up for comments, questions. As you've seen from the tour of the Health Information System Strengthening Resource Center, there's quite a bit there. And this is all in an effort to understand the investments of health information system strengthening and provide some answers to our learning agenda questions about what contributes to HIS performance progress, how to measure it, and the characteristics of a strong HIS, and also documenting the evidence of for packages of interventions and the evidence base for strengthening approaches. We're going to continue to add to the Resource Center as we get more results and more information and hear more feedback for how that's useful. So this is a screenshot of the Contact Us page on the Resource Center where you can enter your name and email address and enter any comments. And that could be anything from that you know that Bangladesh has an updated M&E plan and to let us know how to find that. Or if you so if you see things that need to be updated or other resources you would like to see added, or if you have feedback about the model or how the information is presented, we really welcome anything and everything to make this more useful for people. So thank you very much for your time. I'm going to answer, we're going to stop now and hope that we have some questions and comments we can address during this last 25 minutes of the session.
Thank you, Dr. Heidi. For those with questions, please type your questions in the questions box. And if you cannot find it, you can chat your questions to us. Thank you.
Okay, so at this time we don't see any questions. We'll wait a couple of minutes.
Oh,
We have our
Dr.
first question.
Heidi? Yes, that's right. It's from Dr. Sarinin from Mongolia. It reads, do you have an assessment tool for e-health intervention?
Hi, thank you for your question. I'm going to assign this question to Tariq. Or Tariq, would you like to address this?
Yeah, well, thank you very much. Thank you, Dr. Shireen, for the question. Yes, we have developed a tool. I mean, if you look at the PRISM tool, we are updating it, and we have one module which looks at the assessment of the functionality and usability of electronic systems, especially related to routine health information systems. So this will be we will be posting it very soon. We are just working on some updates and final edits. So please be on the look for that. And in addition to that, we are also working on a maturity model by which you can do an assessment of the country's situation, where the country is in terms of its maturity of the electronic health or e-health systems. So these are some of the work that we are doing, and hopefully we will have them by the end of this year or early next year. So keep a look, watch on this resource center, and we will be posting it on that resource center. Thank you.
Tariq, are those tools, even though they're not finalized yet, are they in a situation where we could, if somebody wanted to test them, you know, like if they have an opportunity, they're not finalized, but it's another opportunity to sort of pilot test them? Is that something that might be feasible?
Yeah, that's in fact we use the PRISM, the electronic system assessment module in the PRISM. We have done a pilot of it, and it's available. So if you want to use it, you know, you can just shoot an email to us, and then we can share that tool with you as well. So I don't know how can we share our email address. Is there any way we can do that?
You can put it in the chat window.
In the
Okay.
chat window. All right. So I'm writing my one, but Heidi, you can write the others, I guess.
And also, if you have a question about one of our assessment tools, you could use the Contact Us form on the Resource Center, and that would be a way for us to respond to you as well.
I think there's another question. Heidi?
Okay. Oh, there it
Yes.
is. Oh, that we got. Thank you.
Is the content inside the website based on theory and evidence that is collected globally and intended to give information for every country regarding the health information system, or is it only specific for some countries?
Such as Africa content.
Yeah.
Okay. I think I want to. I might try to assign this one to Shannon. Shannon, maybe you can speak from the model, but also how some of the indicators were collected.
Sure. So I think if I'm understanding the question correctly, if you look at the map, you can see that we are collecting data on the 30 indicators from 39 countries that are sort of all over the world, including Asia. These countries were selected by USAID and initially started as a very small number of countries and then grew and grew and grew and grew and grew. The idea is that we collect data for each one of the 30 indicators for all 39 countries. And our ability to do that really varies because we have different levels of presence in each one of the countries and different types of responsiveness from each one of the countries. So in terms of just the methodology and the rigor of the methodology, we try to make sure that through desk review and through through desk review we find the most up-to-date document, and that we verify and validate that it is the most up-to-date document or the most up-to-date piece of data that we need to satisfy the indicator, that we can get our hands on through in-country contacts and through our project experts. So that's kind of where we add the rigor. If we're and you'll see in the way that we've categorized and sort of characterized the data that we've found, that there's different levels of I would say like reliability in what we found. So what we do is we just say, this is what we found, this is the most up-to-date thing we have, and we're really looking for countries to respond to that and to use the website, to use the resource center, to use this page on country profiles to respond and say, actually we have something that's more up to date, or actually now we can satisfy that indicator because we did just complete our HIS strategy. So I think that it's been a very dynamic process, it's been very iterative, but the rigor is really in the team collecting those data, making sure that they are looking anywhere they can to find the data to respond to the indicator in question, and that they're getting some in-country validation around that. I hope that answered your question. Tariq?
Yeah, and to add to that, you know, the tools and other resources that's available, those are developed not just based on theory, but also in you know, we look at the practices, applied, piloted, and in the development process, we are collaborating with a lot of other organizations and in-country organizations and global organizations. For example, the PRISM tool, the data quality review tools, and the routine health information system curriculum, for example, these are all developed through a global collaboration with WHO, University of Oslo, University of Queensland, AeHIN, and many other organizations. So it's not just that there is a theoretical basis, but also there is a piloting and testing of those to have more practical evidence-based tools developed and resources developed. Thank you.
Thanks, Tariq and Shannon.
There's another question. Oh,
thank you. Okay, great. Well, we can wait a couple more minutes to see if there are any additional questions. If you see anything pop up, let us know. We have a very small box to view, so. All right, I'm gonna maybe start closing the session, but I would still encourage you, if you're writing or think of a question, to please continue to put that in. Also, Tariq and I have put our emails in the chat box, and you're totally welcome to email us for more information or questions or tools, for example. This has been a real honor to be able to present to the AeHIN community and to show you this resource. We would like to thank the organizers as well for allowing us this opportunity, and I would like to thank my colleagues for presenting today. If maybe we'll stay on for just a couple more minutes in case there's questions that come up, but otherwise I would like to thank you for your participation today.
Dr. Heidi, while they might be typing their questions, I would like to ask, all the available tools on the Measure Evaluation page, do you offer orientations or trainings for project staffs to use these tools?
We do have some online trainings that are accessible, but for more in-depth trainings, I think you'd have to reach out to us and try to see if we can schedule something.
Right. Tariq, do you want to answer that? Because we don't usually do trainings around the tools that are there necessarily. There's usually very good supporting documentation about how to use the tools and apply them, and certainly, you know, our experts would be available to help answer questions about use. There is a new routine health information system curriculum. Again, one could take that and use that in sort of a general training about routine health information systems.
But for many of our tools, like you're saying, we do include our training manuals online, so there's a lot of materials that you can use to self-train.
Yeah.
Yeah, there are guidelines and very well-written guidelines that go along with the tools. So usually it should be like a self-learning method. But like for AeHIN countries, we are trying to organize a training on our HIS curriculum, which has 10 modules and covers a lot of the tools that are necessary for health system strengthening, like the assessment tools and, for example, the PRISM tool, the DQR tool, the rapid assessment tool for RHIS, and so forth. So this is something which obviously has to be organized in country or regionally or globally, and then we can hopefully collaborate and train people. Thanks.
Thanks, Tariq.
All right, thanks for that. I think there are no more questions left. And maybe we can wrap the session, Dr. Heidi.
Oh, okay. Thank you, Cha. That's great. I really appreciated the participation of everybody that attended today. And again, I would just like to thank AeHIN for hosting us.
Thank you so much.
Have a great evening, everybody.
Bye.
Thanks, everyone.